mandatory. And so we have not pushed it as mandatory at the site level. It's definitely highly encouraged for us here. We do have a pretty high vaccination rate at the site. It's almost 90%. So we're very excited about that. And it's been an uphill challenge, but I think the team has handled it really, really well. I think a couple months ago, the news came out with guidance saying that 2 vaccinated individuals.
Oh yeah, because I couldn't figure out how to mute her.
Oh, sorry. Vaccinated individuals could, sit in a room together and they're safe and the risk of, transmission was lower. And I think that came out for a little while, but we probably observed it maybe for a day, but decided to stay as cautious as possible and not to lax on our policies and our mask mandates, just because it was probably the safest thing for our staff. There's a lot of, guidance out there, and every day it varies. And so we thought it was best to stay as strict as possible. Even though we have a large majority of our staff who's already vaccinated, we do have a handful who aren't, and we wanted to make sure we weren't being biased in any sort of way and still, respecting people's personal choice, but at the same time, thinking about the larger picture, which is our safety of our staff, safety of our patients, and ensuring that all of that was at the top of our priority. So some of the things we decided to do was limit, the gatherings from the very beginning, but we do have a dining area for most of our staff, and it's pretty open. And we went to saying, only 2 people at 2 different ends of the table while they're eating, and they can only be vaccinated. So if we did have staff that was not vaccinated, we said, unfortunately, they're not allowed to eat with the rest of the staff, and you get a little nervous because you want to make sure how that message comes across as a company, as an employer. But for us, the primary way was just encouraging that communication and those conversations, so that way they know it's not for any other reason, but then just to keep us safe. We had a lot of those conversations throughout the entire year when we were talking about vaccinations and how to encourage people to get them and if it was the right decision for them. And I think the largest factor that played into the decision was we saw, just like how they show in TV, those little charts of a little body and how when it connects and when it spreads, it's 5 more people and it spreads to 5 more people. We saw that you knock out maybe potentially, a few members of your team, which then burdens more of your staff. And so that, I think, was another factor that played into people's decision to want to get vaccinated. So it did definitely develop that camaraderie amongst the staff. And that was, one of the ways that we chugged through all this difficult time of uncertainty. A lot of the other policies that we did, like I said, we kept those in place. We may potentially be looking at making it mandatory. Some of our sites in the CenXL organization live in a state where it's state mandated. And so at that point, there is no wiggle room and we can't really do much. But in Georgia, as of yet, it is not. And so that begs the question for us, do we make it mandatory? And if we do, what do we do with the few employees that have not yet taken it, who are otherwise good employees? We know as an employer at this time, it's difficult for everyone to find staff and who want to work. And our nature of our job at a site level is that you have to come into work. The remote option is not widely available for a lot of our staff, and there is patient interaction. And so, it's not a decision we've made yet, but it certainly plays a factor into thinking about what next and what to do. And I think this is a great platform to talk about that, because it'll be interesting to hear how other sites have maneuvered during this time and how they've talked to their staff and what kind of conversations surrounded the decision. So I'm excited. I know we have a lot of other speakers here. We have Dr. Gruner and Carol as well. So I'm going to take it back to you, Erica, to introduce to them and continue this conversation.
Thanks very much, Sarah.
Can I ask Sarah a question? 2 questions, actually.
Please.
Sarah, how many employees do you have, roughly?
A little over 100.
Okay, and do you know just unrelated, but do you know the percentage of people that are vaccinated?
We're close to 90%.
Oh, that's fantastic.
Yeah.
I think if I was wearing a hat, I'd stop it to you. So this is such a fluid situation. I don't mean to take this over, but one of the things we're going to talk about, the Biden administration announced on September 9th that the Department of Labor is going to require every company with more than 100 employees to mandate vaccination. And if there's a religious or medical exemption, there needs to be weekly testing. So the CDC issues guidelines that actually don't have to be followed. They're guidelines. And in the beginning, the CDC would come out with one set of recommendations on Monday. By Thursday, it would be completely different. So again, although I respect the CDC and I use the guidelines, I also take it with a grain of salt. OSHA, Department of Labor is law. There is no choice. And there's going to be, I believe, a $14,000 penalty for every infraction. So since we had our introductory call a few days ago, things have already changed. This dynamic situation. So I just wanted to throw that out.
Yeah, I mean, it makes our job that much harder what to push. And, you know, you get employees who are asking, well, this is what's the guidance out there? Why are we not following it? We can go this. And, you know, all of those questions did come up. I think the best way for us to handle it was to have that conversation, to explain it and not just set out a tone saying this is it and that's it, and we're not going to give any background as to why. But we've been fortunate enough that a lot of our staff have understood where we are coming from. And, you know, and I think this goes for all of us, a lot of us started doing vaccine studies and we became very involved with it. And I think we got to see firsthand the change and the good that, you know, came out of it and the positive results. So I definitely think that was, you know, another driving force that helped.
I was going to ask about that. Thanks, Sarah. So Dr. Gruner, please do jump in. And, you know, Emma has asked a couple of questions on the chat. What about remote staff who never go to a facility? Are you specifically talking about as far as being vaccinated, or in states that have mandated vaccinations? Or
we're in mostly Texas. It's not mandated, and people do not ever go into a facility on my team. So I was wondering what the criteria was going to be.
So in the beginning, we were trying to be more flexible, but at this point, it's not really a choice under the new OSHA guidelines. So we decided that we would, if it becomes mandatory, it's got to be everyone. And even the people who refuse vaccination that are subject to weekly testing, it's got to be for everyone. Also, we can't have different standards for different types of staff at this point. It's not practical and it's not really fair. But so let me jump into why I'm here and why I wanted to do this. So first of all, I do apologize for, I should have caught that today was Yom Kippur. I should have pointed that out to Erica, and it's the one holiday that I actually observe, but in the last 2 years, I have no holidays or weekends, so I didn't clue into it. So I am sorry for that. I appreciate everybody who does observe it and is on the call. You don't have to eat while you watch, for what it's worth. Religious joke there. So why did I want to talk to all of you today? You know, when the ad came out, I got a call from a couple of my colleagues saying, have you lost your mind? You don't have time to do this. Well, I don't have time to do this because I spend most of my time fielding questions about COVID and dealing with how to handle staff that are testing positive. So that is consuming 2/3 of my time, and it's gotten worse. Things were under control, and as Sarah mentioned, the Delta variant was a game changer, and it's worse than ever. The numbers are atrocious. 1,500 people a day are dying, and that's mostly due to the Delta variant. It's twice as transmissible as the Alpha virus, the original virus, and more than twice as likely to lead to hospitalization and serious illness. So one question I get a lot that I really want to clarify. People think that the vaccines are not effective against the Delta variant, and that is not true. They are. They may not prevent you from getting ill. That's the key distinction, but they will still prevent you from getting very ill and dying. People that are vaccinated are unlikely to even need hospitalization. if if they've been vaccinated and they're ill with the COVID variant. A lot of infectious disease specialists are saying a lot of admissions are unnecessary with people that have been vaccinated, and maybe they're being overly cautious. So 99.2% of people that are dying of COVID right now are unvaccinated. I mean, the numbers are staggering and just remarkable. So the vaccines are still very effective. And I see this every day, you know, so I'm the chief medical officer, for those of you who don't know me, of Evolution Research Group. At this point, we're up to 20 sites and we have over 60 employees. So I've been leading the March for COVID with a lot of help. You know, with Lori Wright, our CEO, established a committee called the Crisis Management Team. Initially we were meeting daily. We scaled that back a bit, but we still meet very frequently to talk about COVID and how it affects us as a company, and to talk about our mitigation plans, which keep changing. Again, it's a very fluid situation. We established a group of clinicians, including our site directors and our principal investigators. And we meet weekly to talk about COVID and COVID studies. We've been very involved with COVID studies to a remarkable extent, considering the short time that we've been doing these. I'm very proud of that. And to also talk about our vaccine strategies. So at this point, 82% of our company is fully vaccinated, and that includes people at the corporate level. That's actually a very good number. Let's look at what's happening in the country. So in the United States right now, and it depends where you look, but the latest statistics are 54% of Americans are fully vaccinated, 64% have one injection and still need the second. So they're not fully immune. So let's say it's in the mid 50s. Not very good. We need to be way ahead of that at this point. This could have been under control and over with. I mean, COVID is going to become endemic. So in other words, we're going to be living with this for years to come. But we could have had this under control. We could have achieved herd immunity by now. So what's herd immunity? It's when enough of a community is immune to an infectious disease so that it's no longer transmissible. We were hoping that would happen. You achieve herd immunity through one of two methods. You can achieve it naturally by people getting infected with COVID and recovering, and then you develop antibodies, which is what the vaccine does. Or you can get vaccinated. There is a third route, which would be the combination of both. So early on, there was thinking that maybe this could happen naturally. You know, some countries didn't enforce any kind of social distancing and actually just let people get sick, thinking that they achieve herd immunity that way. That was an unmitigated disaster, and people were just dying right and left. So clearly, that's not the way to achieve it. So it's got to be through vaccination, because what do we need? What percentage of people immune do we need to get herd immunity? It's somewhere between 70 and 90%. So Sarah mentioned that her site is nearly 90%, and I mentioned that ERG is 82%. So we're actually in the range for herd immunity, and if the whole country had similar numbers, we'd be there, and this would be under control. I mean, my goal is 100%. You know, we actually have two sites that have hit 100%, so it's definitely doable. So why? So those are some facts. And as far as mandatory vaccination, which is what I really wanted to talk about, and I don't really like that term. It implies that you're holding people down, forcing them to get needles in their arms, and that's not what we're talking about. It's people having to get vaccinated to go to work because they're interacting with other employees, they're interacting with subjects, and we obviously want to keep our employees safe, our subjects safe, their families safe, and we have businesses to conduct also, and we can't afford to have those go down because people are ill. I mean, that's a fact. safety is number one, but we need to keep our organizations running. So it's not really going to be a choice any longer. So we have sites all over the country, including New York and California. So New York and California are mandating vaccination by late September. New York has already removed the religious exemption. It took them about 2 days to decide that they didn't want to go there. California, I believe, still has religious and medical exemptions, but those have to be reviewed. You can't just say that you have an issue. You have to prove that you have a real issue. If it's medical, you can either describe it or you can get a note from a licensed physician. Religious exemptions are much more complicated. Most organized religions are not opposed to vaccination. So you can't just say, based on religious grounds, I don't want this. You have to validate it. So subsequently, as I mentioned, the Biden administration announced that every organization that has more than 100 employees, and I believe it was yesterday, he took it a step further. Every facility that gets federal funding, and this applies to most healthcare facilities, if they get Medicare and Medicaid, I mean, it doesn't apply to us in industry, but it certainly applies to a lot of facilities, they will have to get their employees vaccinated. So it seems like almost every day we're upping the ante here. Now, I wanted to get on this call, not just to educate people, but what I see happening in other areas of healthcare outside of our industry. Let's take a state like California, which is mandating vaccination. So we see cases where one healthcare system is aggressively complying with the law to the point where they're terminating employees who are saying they won't get vaccinated. And there are other healthcare organizations that are being fairly lax about it. I think it'll catch up to them eventually, but for now, the reputation is getting out. So you may have somebody quitting the first organization and taking a job with the second organization. Now, we know in our industry, everybody's understaffed. There's been a lot of turnover. COVID has been devastating. I talk to colleagues in other companies who are telling me they don't have enough staff to function. So we can't afford to lose staff, and we don't want to. We want to keep our staff, but we want them to be safe. So I think it's really important that we get together as an industry and come to some meeting of the minds, and we don't start competing for employees. We don't, have employees say, hey, ERG is tough. I'm going to go to company X because I hear, they're not really enforcing this. It's the last thing we want to see happen. That's not good for anyone. So I'd like to see us on the same page. But frankly, since I agreed to do this, it doesn't look like we're going to have a choice. Mandatory vaccination is coming. It's going to happen. We need to figure out how to do this and how to convince people why it's in their best interest to get vaccinated. So I'm the one who monitors positivity rates in my company. I will tell you, I have not seen it this bad in months. Since the Delta variant, every day I get calls about staff who are positive, and the unvaccinated people are the ones who are getting sick. I'm seeing this myself. The vaccinated people are testing positive at times, but they either get a mild illness and recover, or they don't get ill at all. It's really dramatic. I've talked to the people, the so-called vaccine hesitant, and we've done everything as a company that we could do to convince people to get vaccinated. I mean, I don't care if we have to pay someone. I'm willing to go there. It's worth it. We've done that. There's nothing we haven't tried. So at this point, we're going to need to comply with whatever the rules are, and I hope that's something that we all do. But I don't know. There's nothing that we can do that we haven't done to this point. And we're all healthcare providers. I mean, I think the data is overwhelmingly compelling that vaccination is life-saving. And these vaccines are safe. I mean, the Pfizer vaccine is now fully FDA approved. That gave the government, a lot of power to enforce mandatory vaccination, because under emergency use authorization, you're allowed to decline a treatment because it's considered experimental. That's no longer the case with full FDA approval. It's not experimental. It's a fully approved treatment, and we expect the same thing to happen with the Moderna vaccine shortly. So that's where we are. I don't want to dominate this, but that's basically what I wanted to get out on the table.
Thanks, Dr. Gruner. Before we jump, Lori Wright has, thank you, Lori, for jumping in, because she said that you had mistakenly said 60 employees, but ERG has over 600 employees.
I'm sorry.
Which changes when you said 82%, I immediately thought, well, Sarah has 90% with 100 employees, so 600 employees. I mean, that's a pretty significant,
Sorry, Lori.
Yeah.
I'll probably get fired after this call. Yes, we.
Oh, you will, but, it would be a lot easier if we only had 60 employees.
We have.
Congratulations, Sarah. I mean, that's great, Sarah.
Yeah, we have over
Lori.
600
Hi.
employees.
Yeah, I mean, it's at the site level, I think our numbers are pretty similar when it comes to corporate, but it's hard. Like Dr. Gruner was saying, there's a lot of different pieces that go into each site, including what the state was doing at the time, so we'll see. One thing that we chose not to do was incentivize staff who didn't get it. We just didn't, it's a hard play. And like, I totally sympathize where Dr. Gruner is coming from, where we just want you to get it, whatever we can do. But at the same time, we don't want to say, great, you didn't get it when we weren't giving incentives and now you want it. So it's a tough, it's a tough way
We
to
struggled
maneuver.
with the same thing, Sarah. That's an excellent point.
It's a tough place,
Yeah.
but yeah.
I will tell you that I agree with you wholeheartedly, and I found it distasteful to incentivize people. On the other hand, we had one site that was a challenge, and right after we put an incentive in place, and I'll tell you what it is, because
Right.
Stanford did a study and found out $100 seems to be the amount that changes people's mind. So we gave a $100 gift card, and quickly 13 people that were on the fence decided to get vaccinated. Now, I wish they came to this conclusion without the incentive, but I'll take it.
And I mean, at the end of the day, that's our main goal, right? And it's safety for all. So you get what the primary goal is. So I totally understand it. Maybe we'll do that too after this fall. Hand out, it'll all change minute to minute.
I don't think we have to do that anymore. Like I said, I really think we're heading towards mandatory vaccination, and it's happening soon.
It's
Before,
interesting. Sorry, Erica. I was just going to jump in really quickly. It was interesting because I'm at Siegel in South Florida, and I think everybody sees how Florida is on the news. And so we're in a very challenging state. So our vaccination rate is not nearly as high. It's about 70%, but we had actually, because we were struggling with even getting that high, and it's been a mission. And we don't even have mask mandates down here, and your kids have to go to school with no mask. It's a nightmare, and scary. But what actually helped, before the Biden administration even came out with the weekly testing, if you're not vaccinated, we put that into place at the end of July. So it was either you get vaccinated, or if you don't, we now have a company that we hired, not trusting the staff members to go out and get their own, a company that comes to the site every Monday and does a PCR test on anybody who's not vaccinated. And that actually helped to increase some of vaccination rates, which was sort of the goal, that people obviously wouldn't want to continuously get NPs every Monday. So that increased our, 20 additional employees had gone out and gotten vaccinated. So even kind of mandating that has helped us a bit, but it's hard to manage when your state should just fall off the map at this point.
it's still a good state, Erin. Dr. Gruner, you were saying that the physicians are providing notes, and Judy Goldano is in California in, I think it's Sun Valley, right, Judy? So she's had an employee whose physician refused to give a note. Have you come across that? And what do you do in that situation?
I would evaluate the medical request and exemption myself and determine whether or not it's valid. So you don't have to have a physician note for my benefit. In fact, in some cases, it's been more harmful. And let me give you an example of something that just happened within the last couple of days that's been haunting me. So I got a request for a common exemption lately. One of our employees is pregnant, 7 months pregnant. And she gave me a note from her OBGYN saying that he doesn't think it would be safe for her to be vaccinated. Now, the guidelines, CDC says pregnancy is a risk factor for COVID, and they actually encourage women that are pregnant to get vaccinated. And when I'm asked about this, I mean, I'm not setting myself up as an expert. I'm not an infectious disease specialist or a pulmonologist, but I've immersed myself into COVID for nearly 2 years now, and I've been a practicing physician for 30 years. So I'm not an expert, but I've developed some expertise, and I've read everything I can get my hands on, and I'm convinced that it's safe in pregnancy and necessary, and it doesn't cause infertility either, as Nicki Minaj claimed it did on social media. I mean,
Yeah.
she's qualified to say that. So I granted the exemption because with the licensed physician writing a note, especially OBGYN, I felt I had to, but I also let her know that my recommendation was still to get vaccinated. Then I saw something on the news a couple of days later. A nurse who was also 7 months pregnant got COVID, and she actually was on a ventilator, and she delivered her baby while on a ventilator and died as soon as the baby was delivered. Her husband got COVID, and he died 2 weeks later. Besides the newborn, they have 4 children under the age of 8. They were both unvaccinated. And of course, on their deathbed said, oh, this was a mistake, should have gotten vaccinated. So this haunts me, although I still think I did what I had to do because of the physician's note. So in some ways, I'd rather not have the note and just hear what the condition is and decide. But people should be going to their physicians and get their opinion. So I don't want to not support that, obviously.
Great. All right. Thank you. I wanted to get Carol Witham, who's with Pillar Clinical Research. I also wanted to get her input on what's going on at Pillar. You with us, Carol?
I think so. This technology drives me cuckoo. I've spent 15 minutes trying to get on. Thanks, Erica, for giving me the opportunity to kind of chat a little bit about kind of our experiences and maybe a little bit of a different approach. Not necessarily meaning that that's the right approach, but just another approach that we could look at, offering sites some support. Number one, I am absolutely not an expert. I'm not a physician. I'm just coming at it from more of an operations standpoint. And I wanted to go a little bit beyond just the COVID talk about the vaccination, but also the elephant in the room, which is staff. So I'm going to go through, I want to be really quick because I love to hear everybody's opinions and thoughts on the call. I think there's a lot of people on. It looks like 100. Holy cow. So just bear with me as I'll quickly kind of skim through what I was thinking. So, people have been asking me in the last, 8 months, how are you dealing with COVID? What does it look like at the site? How are you navigating? And I also have a day treatment center. So I am dealing with healthcare setting in a holistic approach with Medicaid, Medicare. So it's a whole nother ballgame. I often will say, I use that empathetic ear approach. And if you've ever heard of that, it's just a lot of one-on-one conversations, building trust, coaching, mentoring, discussing people's fears and struggles, not only in the work environment, but also in their home. Acknowledging people's fears. I think sometimes, if you've been vaccinated and someone hasn't, to be empathetic and understand why they're not, and how can you navigate through that concern. And, you know, one of my main things is avoiding potential group training or group education. I think having individual conversations, developing trust with each of your employees is an important part. It would be a little bit harder, obviously, as Dr. Bruner was saying, 600 employees, that's a little bit different system than, you know, 150. You know, some people say, does that really work? I mean, what is your vaccination rate? A week ago, I had no clue. I did find out from our HR this morning just to get some real numbers. And she said that we're reported at a 90% vaccination rate at all of our sites as well. We don't have 600 employees. We have about 150. You know, we're navigating the COVID crisis through just following the local and the state and the federal laws, obviously evaluating all the OSHA regulations, and following the CDC guidelines, just like everyone else. I don't think we're doing anything different than most other sites and individuals and any companies on this call. You know, one thing that has been interesting is that since this whole process started, as a CEO, I have yet to create any kind of formal communication to any of my staff, other than the following the regulations and having those kinds of formal conversations. But as far as the vaccination, I haven't had that kind of conversation. So people will say, well, how do people know what your stance is? You know, I think it's been an untold scenario that we're trying to get as many people vaccinated as possible, and giving the basic information that's out there right now on the ever-changing navigation of data that's coming out on a daily basis, et cetera. But just to give you an example, and I wanted to kind of read this, that, you know, yesterday I received an unsolicited text from one of my staff that's part of the BIPOC community, which is, as we know, that's been an area of concern with health disparities, who wrote in quotes, "Guess who got vaccinated today? Yay!" and a big emoji sign that had a smile. And you know, that was just an untold text of the importance of having those relationships with your staff, verbalizing your concerns, sharing personal stories about COVID, ways that you're concerned and you want to provide protection for you, the staff, the patients that are coming into the clinic without having a specific mandate. That's kind of our approach. Again, it's not necessarily the approach for every clinic. It just might be, you might want to take a couple things out of that, just like I'll take a couple of things out of the advice of others that'll better take care of people. The second thing, and I have like several, but I just want to quickly go through it. The elephant in the room is what? Staff, staff retention. Related to, you know, the last 2 years, there's been a lot of trauma. People have experienced trauma related to COVID, not only at home, but in the workplace. And what is the current crisis in our industry and how is that impacting site operations? So, you know, obviously amid a massive labor shortage, companies have boosted wages to try to attract and retain employees. But on a site level, how do we combat that? Because that's been a challenge, right? I think everybody on this call can vouch for that. And I think the ways that we can do that is to be honest and open with our sponsor partners. I think, I don't know how many times I've been asked by a sponsor, how are you guys navigating COVID? How's your site doing, et cetera, et cetera. And my first response is, well, we're just navigating through it. We're just working. But are we really? I think we are, obviously. But what are some of the ramifications of some of that? So we're working through the challenges of keeping staff who have the opportunity of staying home and versus increasing the risk by coming to work within the healthcare setting, whether you're in research or in healthcare and part of the ecosystem at the hospitals. That would include raters, right? Coordinators, PIs that can do virtual, medical monitors that could be working behind the scenes at home. Those are some of the challenges that we're experiencing. In the clinics, obviously, people and staff are wanting flexibility and autonomy. However, that's not necessarily something that can happen in a clinic, right? I mean, all of us that do research, we have timelines, we have vital signs that have to be done at a certain time. There's a lot of stressors within that. So not a whole lot of grace in the demands of perfection within research. So sites are combating, how do we maintain how do I say this? Maintain the stability within the site and not lose them all from our vendor partners within research. Because we're all in this together. If the sites fail, the CROs fail, the sponsors fail, the vendors fail, et cetera. So those are some of the challenges that we're experiencing. Obviously, researchers, a lot of them are trained on a site level. So losing our trained workforce to other partners in the industry have been a devastating manifestation over the last a year and a half. It's been interesting because I was out of this business for about 6 years. And when I came back, I noticed a lot of the budgets, for instance, were about the same as they were 20 years ago. However, the expectation of working with other groups within the industry to make these studies move forward have become labor intensive. So the struggle of the higher salaries and sign-on bonuses, how do you navigate that? How do you decrease the exposure of working from home versus decreasing the interaction with the population that we're serving, et cetera? Those are just some of the things that have come up. We're looking at, in the last 2 weeks, HR, different forms of ways that we can recruit staff. And we're going to be piloting that within the next 30 days or within 30 days. And be happy to share that information as we find out successes, because as we all know that we're all in it together. And even though we're competitors to some degree, all sites, we've got to kind of stick in there together because we're the ones that are hands-on with individuals who are depending on us to do the research. So those are a couple things. I didn't want to go into all the other areas that I had mentioned because I think we have like 15 minutes and I really would love to hear other people's thoughts.
Thanks, Carol. This is Zach and Dr. Johnson from iResearch. Hi, everybody. So we took the same approach that Carol was talking about, just spending a lot of time again with employees. I think now most of my time is spent just with employees, chatting with them, addressing fears, talking about experiences. Same thing for Dr. Johnson. Her phone starts at 6 a.m. Dr. Johnson's our medical director for iResearch Atlanta and Savannah. And Dr. Johnson had us prepped for COVID really early on. We were all wearing N95 masks back in April of 2020, continued that. We actually then became a vaccination site for the state of Georgia. So we had a ton of people coming in and we had a ton of vaccine on site. So majority of our staff then wanted the vaccine because it was scarce, right? the minute you can get it, you want it. I think that's why we are at 100% vaccination rate. We're at 95 employees, but I think it is because we had that period of people couldn't get it, and so they wanted it. And then
the last 10 were more difficult though, and that took a lot more relational and patience. Not too demanding. And then now that we've gotten everybody vaccinated, we're now mandated. So when we have new employees that are coming in, we can basically start fresh.
So we did our site, we mandated it. And so now, we work with, I'm sure like everybody else, several different agencies out there looking for talent. And that is part of the requirement now is don't even send us a candidate unless they're vaccinated. And it's probably a little bit of the unpopular, I think, decision, but I think since now it's like you're starting fresh with employees, it's helped. I think going back now, the morale that I think at the site, there are so many people that are hearing so many sad stories again. We had a patient who was admitted last week. She's 53 years old. Her daughter was 29 years old and her granddaughter is 9 years old. And the grandmother got a call that her daughter, 29 years old, is dead in the floor. And the granddaughter, 9 years old, was the one who found her. The entire staff got to hear that, right? I've never heard a mother scream after losing her child. It was heartbreaking. And I think when you talk about those stories, it really gets people to a point of, this is not about, it's not going to change your DNA. It's not going to make you infertile. Like, we are talking about people and lives. And that has been the approach we've taken. We all kind of step back that as an executive team and realize, all right, we got to do something because we are going to start losing these people. We are very lucky. We have a pretty low turnover rate. We have some turnover, but but it is pretty low, especially, the raters right now are the big, a big portion of the staff that I think continues to get, kind of scouted and by vendor partners and things. But we sat back, we implemented a one time a month. We have a 1 day mental health month a month. So 1 day we're closed and enjoy your day. Everybody's paid for the day, but we're closed. We've done that. We also we brought in an outside company to provide mental health counseling. So it's an outside vendor. She doesn't work with us. She's remote. So she provides it to the staff. We cover the cost of that. Just trying to think about different ways to support the staff. And those have just been a couple of things that we've done. Anything that I missed?
No, Dan, I like your idea of having a site consensus. The more we can all agree to try and get our staff vaccinated and people won't doctor shop from one place to the other. I think it's puts ourselves on a higher ground to do the right thing and to have people not site shop.
Someone asked here, if we're going to be, for the companies that are mandating the vaccines, are we also mandating the boosters? I would be interested to hear what, other sites are doing. For us, we've noticed that majority of our staff that is vaccinated is anxiously awaiting the boosters. And so like Zach mentioned, we are also vaccinating the community, and it'll be easy because then our staff will just set aside a day. We already planned it. And this is when we'll actually, vaccinate and give the booster out to our staff. But, anytime we open that vial up and we say, we have a couple people here, 3 extra doses, and it's like, who wants some? What can we do to encourage people? We like to throw that out there. And sometimes, every couple of weeks or so, we'll get someone who previously wasn't vaccinated and say, they've been thinking about it. Okay. And now finally they'll jump in and get vaccinated when they see they have a couple open because of the convenience. So I think that's certainly an added positive factor that we have. But for us, I would be interested to hear what Dr. Gruner says about that. But those that are already ready for the booster, they're wanting it. So there's not much convincing or mandating that we would have to do for that piece of it.
Yeah, I agree. I think that if someone's fully vaccinated, they're on board and they're certainly going to comply with the need for a booster. I saw another question, and I get this a lot. If someone has been ill with COVID and recover, how does that tie into vaccination? So you do have temporary immunity once you recover from COVID based on a buildup of antibodies, but it's not sufficient, and it's unclear how long that protection lasts. So the current recommendation is that you still get vaccinated. Originally, the recommendation was waiting 90 days. Now the recommendation is 30 days. There's really no safety issue. It really has to do with boosting immunity. So I think 30 to 60 days really is a safe range, and I recommend 30 days. But you absolutely still need to get vaccinated even if you've recovered.
We follow the same guidelines. I also tell people we're trying to get people fully vaccinated, and the guidelines, the data is still changing. We are still learning, and that the goal is to have people fully vaccinated, whatever that means 6 months from now, as we learn more data. But right now it's boosters. It's 1 dose after people have been vaccinated. People ask us about which vaccine to get. I go a little off script, and people that have had Johnson & Johnson recommend they get one more vaccine as their booster that is not Johnson & Johnson. That's a little fuzzy right now. And then to stay with their same vaccine if they got a messenger RNA vaccine. But if they can only get one or the other, which is really not a problem in the United States, then they're fairly interchangeable.
Johnson & Johnson is actually doing a study looking at a second injection and whether or not that boosts immunity, but we don't know what the data is showing yet. My guess would be that a second injection would boost immunity because the level of immunity with the J&J vaccine is lower than it is with Pfizer and Moderna. So a booster
Carolyn asked,
a second dose. I'm sorry. Go ahead.
yeah, Carolyn asked if if you get a Pfizer booster, can you get a Pfizer booster if you have Moderna or J&J vaccine?
It's not recommended. The recommendation is that even though they're both messenger RNA vaccines, the recommendation is to stick with what you got initially. So if you got Pfizer, get a Pfizer booster. If you got Moderna, get a Moderna booster. And there is no problem with supply. So that's not an issue at this point. And right now you have to be immunocompromised to get the booster, but I think the administration is saying after 8 months, anybody can get it. I believe that's going to change soon as well, because there's some evidence that immunity declines as early as 6 months after the second injection.
Hey, Erica.
Yeah.
Is there
Carol?
anyone, because I'd kind of love to hear a site's perspective regarding operations, because I know we focused a lot on the vaccine, the process, which I think is very important, and I'm glad we did that. But we also, how does that impact the site operations based on, I mean, there's 100 people on this call. What are some of their experiences that that they have related to that?
Specific to people getting ill or staffing issues?
So I'm seeing some questions about, what do we do if, practical questions such as, I'm a small site, I have 1 or 2 staff out. What do I do? Those are, those are important things to discuss too.
For us, we can certainly speak to it, whether you're small or large. I think the hit is there regardless. A coordinator and a research assistant, every role plays a very heavy, it's a very heavy role that they play at these sites. And so anyone being out definitely is hard on us. And it's hard when we have that schedule and we have patients and subjects already scheduled, or there's a heavy day. And I think that's where, unfortunately, the burden falls to the remainder of the team, which is one reason I think that a lot of the staff have initially wanted to get vaccinated, because they see that 1 or 2 people out, the pressure it puts on others. But that's a very real fact that we're dealing with at the site, that is burdensome. And we're dealing with, staff burnout and having to look as leaders of the site, okay, what do we have next week? What do we have in the coming weeks, or even the next day? Because these call outs, like, someone mentioned here, is their kid is sick and they can't come in because it's potentially exposure, or a family member. When that happens, it's all hands on deck. So we've had people in every single department, it doesn't matter what your role is, get trained on these protocols, get on these Dell logs to then be able to jump in, whether it's screen consent or just pull a vital sign and triage someone for me. That small piece is a huge help for the rest of the team. So, it's definitely hard. It's burdensome. I don't think any of us have the answer, because it happens so unpredictably, and the schedule has been set, patients are there, and we don't want to disappoint, those that are scheduled to come in. We have to take all those pieces into account. And so it's definitely puts us in a difficult spot. And that's where everyone relying heavily and working closely as a team come into play.
So I guess my question would be, I think those are all great concepts, is that this is only an hour, session, right? And this is a hot topic. It's relevant to all of us. There's a lot of people on the call. It's needed discussions. What if we created work groups or work group related to this discussion of how can we engage our sponsor partners to help us navigate through this, where we're not alone in this? What are ways that we can be candid with them and tangible examples other than, hey, we need resources, we need money, but how can we systemically change the way we're headed? Because we might all look up and there's nobody doing the hands-on work. Just like in the hospitals, if we don't take care of our healthcare workers that are tangibly working with patients on a day-to-day basis, we're going to get in trouble. Medicaid and Medicare has to look at that as well. And I think they are looking at incentives because we're getting into a crisis where, you can work for private insurance or you can do other things that are less risky, right? And financially benefit from that. So how can we protect the workers that are interacting with the most vulnerable population, especially in CNS, in my opinion, to ensure that we're continuing to take care of people? So is this something that we could initiate? Would you guys on the call be interested in something like that? I think this is a conversation that should be had and should continue.
Carol, this is Bernadette D'Souza. Can you hear me?
We
Yeah,
can.
Yeah. Carol, I'm just wondering, this has been going on for some time. And during the period of time before you got to the 90% vaccination rate, you must have had some of the similar problems. How did you deal with it at the site level? Just a couple of examples would be helpful. Like when somebody calls out, or the bigger thing is when somebody says they were exposed to somebody who had it and had to be quarantined, and then they don't come into work.
Right. It has absolutely been a huge challenge, just like everyone else. So, the experiences that I've had have been very probably exactly what everyone else has, which is, I think one thing that we've had to do is you deal with it one step at a time. And I think being the calm in the storm. So you have someone, you isolate them quickly, you get coverage quickly, but in the midst of it, you can't be with your the sky is falling kind of leadership. You have to have a very calm presence and controlled presence in a very uncontrolled environment with a lot of variables that we don't necessarily all have the answers to, right? So, that has been a huge challenge. We had a lab person who was unvaccinated that, that was a challenge. She had been involved with a lot of people, around a lot of people. So how we did that is obviously we tested rampantly. Fortunately, there was, we've had a mask mandate, et cetera, to help protect as much as possible. But I don't know that I have the answers, Bernadette. I wish I did.
Yeah. I would imagine I would imagine there's other operational implications like, out of visit windows, protocol deviations, and those kinds of things too. And where the sponsors have been supportive, or, how have they been? Because verbally, I know there's been a lot of support, but yet they are violations, they are deviations and things like that. So
I always, I'm constantly talking to the sponsors about being kind and grace in an environment that research is very detailed and gives no grace, right? So, I think, just explaining to them many times and being vulnerable, because you don't want sponsors to think you don't have control of the scenario, which none of us really do. But you try to navigate through that. And, we've seen Bernadette, staff all across all spectrums of healthcare, people having meltdowns in the office about somebody ordered the wrong pair of gloves, and how could they have done that? And the sky's falling, that emotional meltdowns that we would have never seen 2 years ago. And I think that just shows the trauma related to COVID, and how that's really impacting the workforce. And, we're constantly trying to combat, how do you deal with that? Trying to increase employee morale. Sometimes that's hard when there's a lot of home stressors, right? And so I think communication is a key in this, et cetera. And I don't want to sabotage the conversation. I just, because I really wanted to hear from other people.
I just want to make the point, remote ratings, I think, can be a huge help, because even if someone is positive and they're at home and they feel well enough, they can still rate remotely. Mm-hmm. And that's a direction we're definitely heading in more and more.
Yeah.
I can say from a sponsor perspective, we've had some challenges, because we had an outbreak at our site, and 2 data entry staff, 1 coordinator, and 1 of our research assistants were all out at the same time. And there was a delay of data entry. And you would have thought from this particular CRO, when she was here, she barreled through a door and was yelling at me about where my data entry staff member was. And it took me a minute to just be let me not knock her out, but 1, calm down and maybe ask about why things are delayed. Because when I have 4 staff members out because there's a global pandemic, there's only so much we can do, because we still have to continue with the visits that are happening and the patients that are in my facility. They still have to get seen, whether it's with 1.5 staff members that are there. My data entry is going to be delayed. I'm sorry. Everything else is going to get done the way it needs to, because there's, vital time points, rating scale time points, but the data entry is going to be delayed, and it's the world is not going to fall apart because my data entry was late.
But I think there's power in communicating that in a group setting. Hey, can you guys give us grace? Can we do ratings from home? Can we support each other's sites? Many of us on the call probably have more than 1 site. When you have 2 raters out, can we utilize a rater from another site? Can we think outside of the box of ways that we can support the staff on site with all of our sites?
Yeah, that leads me to think about, when we asked about placebo mitigation, not placebo mitigation, I mean, the COVID mitigation strategies at the site, we might want to add, sponsor communication for accommodation. And if we all do that, then that might have more power, rather than, because they are beginning to ask that in feasibilities about COVID mitigation plans.
Oh, it's a very routine question, has been for some time. I know we're running out of time. There's just one last point I wanted to make. So transmission of the Delta variant generally occurs from somebody unvaccinated to somebody vaccinated, but we're seeing more and more vaccinated people get infected, and that's contributing to the staffing problems. So just another reason why it's so important for all staff to get vaccinated, because even if you have 10% unvaccinated, they can infect, 1/3 of the staff. So I'm getting a lot of calls from staff that are vaccinated, upset that they're being exposed, and it's certainly understandable. And I know we're running out of time. We could probably spend another 2 hours talking about all this, but it just illustrates what a sensitive topic and how important it is. And I agree with Carol. I think we need to take this somewhere and work together and try to figure this out as an industry.
Okay, so thanks everybody. And we have sort of exceeded our time here. Thank you so much, everyone. I really appreciate it, Dr. Gruner, Carol, and Sarah. We will, to everyone who's on the call, we will follow up and send out you know, maybe we can send out a quick survey on how many of you would be interested in doing a work group to respond to some of these issues and work together on them, because it certainly makes sense, you know, if everybody's in the same boat, which we all are. So we will do follow-ups on that. And if you need to get in touch with Carol, Dr. Gruner, or Sarah, please do feel free to send me an email and I can forward that along for you to any or all of the speakers that we're co-hosting here today. And if you have any further questions, feel free to forward them as well. And thank you all again so much. And again, Happy New Year.
Happy birthday, Erica. Happy birthday.
Thank you. Thank you.
Thanks, everyone.
Thank you.
Thanks.
Great
Bye-bye.
discussion. Thanks, everyone.
Bye, everybody. Happy New Year.
Happy New Year.